I'm Kim Shapira, a registered dietitian in Southern California. Today I'm going to talk to you about pregnancy and nutrition. The American Dietetic Association recommends that all women of childbearing ages should maintain a good diet and a healthy lifestyle to help pregnancy health and to reduce the risk of birth defects or chronic health problems in children. Some key factors in maintaining a good diet and a healthy lifestyle are to have an appropriate amount of weight gained during your pregnancy, to have a wide variety of foods throughout your pregnancy, to have vitamin and mineral supplementation at least one day before you become pregnant and throughout your pregnancy. Also, to avoid alcohol, tobacco, and other harmful substances throughout your pregnancy. And lastly, to make sure you handle your food safely and that others do as well. Foodborne illnesses are harder to fight during your pregnancy. Let's start with what's an appropriate amount of weight to gain. If you are starting out at a normal weight, you should plan on gaining between 25 and 35 pounds. If you're starting out underweight, you should plan on gaining about 28 to 40 pounds. Women who are overweight to begin with still need to gain about 15 to 25 pounds. And obese women still need to gain about 15 pounds. It is important to follow your appetite and to eat when and only when you're hungry. Don't be fooled by the old saying, eating for two. You need to trust your body. Your body, pregnant or not, will tell you when to eat. You may find it easier to eat small, frequent meals. Generally, this will make it easier to keep your energy up. Studies show that pregnant women do not need to increase their calories for the first trimester or first 3 months of their pregnancy. It is strongly recommended that during the last 6 months of your pregnancy, you may need to increase your calories by about 300 per day. But each individual body is different and may require more or less. Trust your appetite to help guide you. Gaining too much weight doesn't come without problematic repercussions, like longer labor. It may also cause a difficult pregnancy, and not to mention gaining extra fat will definitely make it harder to return to a normal weight after you're pregnant. On the flip side, not gaining enough weight may also come with some problematic repercussions. For instance, your baby will not get enough of the vital nutrients he or she needs to grow. If you are finding it hard to maintain any or all of these key factors during your pregnancy, please find a local dietitian for a consultation or let your doctor know right away. There are some special key nutrition points that you will need to consider during your pregnancy. It is vital to eat the recommended number of daily servings from the food pyramid. This will ensure you get most of the nutrients you need. If you are not sure of what the servings are, please check the box of any cereal or go online to the American Dietetic Association website. Definitely take a prenatal vitamin. Ask your doctor for some suggestions. Also, be sure to include foods that are high in folate, such as egg yolks, orange juice, strawberries, spinach, broccoli, beans, or fortified breads and cereals. Here are some general healthy eating guidelines. Eat breakfast every day. Eat high fiber foods to prevent constipation. Always have easy to grab healthy foods available, such as fruit and vegetables, either fresh, frozen, or canned. Try the pre-cut. Just as eating healthy is vital to your pregnancy, so is avoiding potentially harmful foods. Here are some foods to avoid because they may harm you or your baby. Be wary of anything that is not food, like dirt, detergent, ice, or even clay. If you are finding yourself craving any of these foods and some others that I haven't mentioned, please talk to your doctor. Some fish that you should try to avoid in your pregnancy because of their high mercury levels are shark, swordfish, king mackerel, and tilefish. Mercury can build up in your unborn baby, which then can lead to problems with their developing nervous system. During pregnancy, it is really best to shoot for less than 12 ounces of any fish per week. That's about 2 meals per week. Raw food is another big one. This means raw fish, sushi, or undercooked chicken or meat. These foods may contain an extremely harmful bacteria. Another food category to avoid are soft cheeses and cold cuts. The soft cheese include goat cheese, brie, and feta. The cold cuts include any lunch meat or hot dog that has been sitting around for a while. These foods may also contain a harmful bacteria that can really make you sick. Try not to eat anything that isn't pasteurized. Although alcohol and caffeine are technically not foods, I would like to include them on my avoid list. Alcohol consumption is linked to an increased risk of miscarriages and stillbirths, while excessive drinking may cause fetal alcohol syndrome, which causes facial deformities, heart problems, mental retardation, and low birth weights in your baby. And caffeine may speed up your heart rate. Studies show that by drinking more than 200 milligrams of caffeine a day during pregnancy, it may slow fetal growth. So it is not entirely true that you should avoid caffeine, but you should significantly cut back to prevent any potential problems with your little miracle. Pregnancy doesn't always come in a pretty package. With all of these many changes going on in your body during pregnancy, is it really any wonder why we can have the occasional pregnancy-related ailment? Constipation for one, those dreaded hemorrhoids, nausea and vomiting, heartburn, bloody gums, bloody noses. Here are some tips to help manage these pregnancy discomforts. With constipation, you need to drink a ton of water, at least 10 cups of water, juice, or milk every day. You must exercise every day. This will really help make things move through your body. And of course, fiber, fiber, fiber. Read your label and try to get at least 25 to 30 grams of fiber a day. You can find fiber in whole grain cereals, whole grain breads, beans, fruits, and vegetables. Another pregnancy discomfort is nausea and vomiting. It is important to eat small, frequent meals, say every 2 to 3 hours, something small. Also, try not to skip meals. An empty stomach sometimes makes the nausea worse. Try to keep food on hand at all times. Sometimes you just can't get to your next meal. But by carrying food with you, you can be prepared for anything. You can also try eating something before you go to bed. This definitely helps make the mornings less awful. With heartburn, it's just like everyday reflux. Try limiting your carbonated drinks. We don't want you to eat or drink anything that is going to cause you to burp. Definitely don't lay down for at least 2 hours after you eat anything. Try eating small meals and skip the gum and straws. These sometimes cause air to get into your stomach and cause irritating burps or heartburn. And lastly, bleeding gums or bleeding noses. If this is a problem you have, you may just need some extra vitamin C. Ask your doctor to be sure. All in all, pregnancy is a beautiful and magical time, and emotional, and stressful, and tiring. Please be careful to take extra good care of yourself. Remember to laugh often and sleep well, and of course, to eat well. I'm Kim Shapira, your registered dietitian for Professorate.com.